So we'll put you back on the speakers list.
Yeah.
Doherty. Okay, Dr. Ellis, you have the floor.
Well, thank you very much, Chair. You know, here we are, we're 9 years into a coalition government that really has done nothing but allowed this public healthcare system that we all hold so dear, and one that I worked in for many, many years, all they have done is allowed it to decay. And how do we know that? Well, you know, in this committee we've often talked about data. And so the question then becomes, what evidence is there to say that there is decay in the public health care system at the hands of the NDP Liberal coalition? Well, where to begin, Chair? I guess that's probably the bigger question. The most obvious difficulty that Canadians have is access to the system. And when you begin to look at access to the system that we have, of course, everybody around this table would clearly realize that access to the system that we have is predicated on the fact of having access to primary care. Primary care providers, whether they be nurse practitioners or family physicians, what they allow folks to do is to have that requisition for blood work, or to have that x-ray requisition, or the referral to see a specialist. And in spite of the fact that we want to return to this grandstanding motion, which was tabled and interrupted our important witnesses related to the opioid study, what we know very clearly and very simply is that when Canadians don't have access via a primary care provider, it doesn't matter if we have the best performing healthcare system in the galaxy. And I only say that not to be hyperbolic or sound foolish, but to outline the fact that without access, regardless of the system, there is nothing. There's nothing for those 6.5 million Canadians who do not have access to the healthcare system that has been held so dear by Canada for an incredibly long time. So I would suggest to you, Chair, that certainly would be the first metric that we want to look at. And we know that has deteriorated over time. We know that 20 to 25 years ago that people would have had their pick of a family doctor. Family doctors made house calls, etc. And what have we seen happen to the system under the NDP Liberal coalition is this incredible degradation of access, which, as I said previously, it certainly doesn't matter what system you have if you can't access it. I think there's a few other things that we need to outline. There's an horrific story of a gentleman who was paralyzed in Quebec. He had a long history of paralysis. And the sad thing is that he waited so long in an emergency room for care that he developed horrific bed sores. And as I'm sure many folks here are not quite aware, bed sores are an incredibly difficult thing to heal. They are often open wounds, let's put it that way, that persist for a very, very long time, that can require significant nursing care, significant offloading of the area to allow it to heal, which of course, if you have a problem with paralysis, it becomes very, very difficult. And when you think of that, you know, this gentleman developed these bed sores because of the fact that he had to wait in an emergency room for days on a stretcher in an inappropriate setting for someone with his care needs. And I'm going to come back to that story in a second. I wish I could tell folks around this table that was the only story we heard of system failure in the emergency room. you know, as I return to Nova Scotia every weekend, as many of my colleagues do, I guess I would challenge anyone around this table to tell me that they have not heard a story from a constituent as to how long they waited in the emergency room. And sadly, it's almost become like an abhorrent badge of honor to say that, wow, you know, I waited in the emergency room for 16 hours, you know, and we hear these stories, and you know, as a former physician providing care, I find that it's unacceptable. You know, even in the days when I practiced in the emergency room, which wasn't that long ago, often if I worked a Friday night till 11 o'clock or midnight or 1 in the morning, whoever was coming on the next shift, I always thought it was my goal to basically have the waiting room empty when the overnight physician came on. And that way that gave them an opportunity to then look after the most seriously ill patients that were inside the emergency room, perhaps waiting to go to the intensive care, or who were waiting for test results to come back, who had been in a traumatic accident, who had been suffered from stroke or heart attack, etc. And that was always my goal, is to have that waiting room emptied, so that then the person coming on overnight, again, could have that very, very fresh start. And as I said, when all of us around this table go home every weekend, I would challenge you to say, how many of the people who are voters in your community have come up to you and said, I have had to wait innumerable hours in the waiting room? I would love to do a straw poll around the room, but I know that that's not something that perhaps people would like to answer. But we know that it affects Newfoundland. We know that it affects Quebec. We know that it affects Ontario, both urban and rural. We know that it affects PEI. I know because, Chair, people from PEI, when I've been there, have come and told me that it affects PEI. I know that it affects BC and Alberta, Quebec once again. Even Saskatchewan is affected by this. So as we begin to understand the difficult nature of this, this is what has happened under this coalition, who now at the, I don't know, it's beyond the 11th hour of a struggling government. It's the 23rd hour of a struggling government. Who now want to bring forward these motions to say, well, Canadians should entrust them to fix health care. Are you kidding me? What credibility does the Liberal NDP coalition have to say they can fix health care when it has done nothing but spiral negatively in the last 9 years? They have no credibility. Not to mention the fact that somebody told me, they'll remain nameless. I had the good fortune of being home this weekend at the first annual Nova Scotia Stampede, and we had a charity hockey game while I was there. And one of the hockey players, who is notable, and I will not name him because I didn't ask his permission, although he told a great story.
You're okay to use my name.
that he had been to the emergency room with his children. And, you know, one of them, he said, we were there with the child who perhaps wasn't that unwell, but he saw another child with a broken arm. And he said, I know that I'm not a physician, but I could tell this child's arm was broken. And that child waited 14 hours, 14 hours in a waiting room with a broken arm. Now, realizing, yes, there's a triage system, and we could argue, okay, well, everybody knew the arm was broken, et cetera, et cetera. but as Canadians, you know, doesn't that pull at your heartstrings to say this is a child waiting with a obviously disfigured arm and didn't get the service that they needed, that they required for 14 hours. This seems like a, you know, I wish it was a once in a, as we say, a once in a blue moon occurrence. It's not. I've known people that have waited so long with a laceration that by the time that they had an opportunity to see a treating physician, that they didn't even require stitches anymore. Their wound had healed, basically. And I'm not talking about some miraculous healing. What we're talking about is a wound that was held appropriately and tightly, and after the terrible amount of time that had lapsed, that, again, the wound did not need suturing, which is, it appears fantastical, I know. But these are stories that everyone around this table has already heard. And if I might, Chair, return to my story of metrics related to the gentleman who had paralysis and ended up with severe bed sores after waiting many days, not hours, we're talking about days in the emergency room on an inappropriate surface, who then, I can barely even say this out loud, but I know, again, it was reported in the news. I'm not making something up here, but it's hard to speak the words that gentleman chose MAID because of the bed sores that happened to him at the hands of a healthcare system in the greatest country in the world. And again, that happened under the NDP Liberal Coalition watch. That's when it happened. And we also know that things have gotten worse over time, that, you know, the system perhaps has been struggling for a long time, but we know that at the current time, wait times to have treatment after you see a family physician to seeing a specialist has increased to the worst it has been in 30 years. 30, not 13, 30 years. That the average wait in this country after seeing a family doctor to that ability, because of course, as we all know, you need a referral from a family physician to see a specialist, that wait has ballooned to 27 weeks. 27 weeks, which of course is a half a year. Now, again, I know we have physician colleagues here, and I appreciate that, and I would suggest that in most cases, when a family physician has exhausted all of their knowledge and training and experience that they have, and the tests that they have ordered and the assimilation of that information, that the expectation, and I know mine would be as a former family doctor, that my expectation would be that I have done all of that work that's required, and now to wait 6 more months to have the opinion of a specialist who's, again, extra training and extra experience is required to either make a diagnosis or confirm treatment, that has now ballooned to more than 6 months. That's not acceptable. That just isn't. That's not the expectation of Canadians, and it's certainly not the expectation of family physicians who serve the patients inside the system. You know, we even know that in many communities, the wait time for getting an appointment to have blood work done is more than a month. So as we begin to look at these metrics, and I think that's where our focus needs to be here, as we begin to talk about allowing a motion to happen on another study from the very group of people, the NDP Liberal Coalition, who allowed the system to fall apart, seems rather sanctimonious and frivolous to me. Now, what other metrics do we have to say that the NDP Liberal Coalition has failed healthcare in this country? Well, there's anybody who would like to. I have, perhaps unlike some of my Liberal colleagues, I don't have dealings with this company. I don't have a financial interest in that company. That's not how I work. But that being said, there's a great website called secondstreet.org. And when you begin to look at that, some of the work that they have done is based around how many people have died in this country on a waiting list, which is absolutely shocking. You know, does that mean you're waiting for a CT scan? Are you waiting for an MRI? Are you waiting those 6 months, as I already spoke about, to see a specialist? Are you simply awaiting a blood test? Are you waiting something, you know, perhaps more invasive, like a bone marrow transplant, etc.? And as you begin to look at those numbers, they're absolutely shocking, because the estimate is between 17 and 30,000 Canadians die every year on a waiting list. I'll say that again. 17 to 30,000 Canadians die every year on a waiting list. And as you begin to fathom that number, remember that that these are Canadians. They're not some anonymous person that you don't know. These are your mothers, your sisters, your aunts, your uncles, your fathers, your brothers. All of those things, all of those people are people who can die on a waiting list. You know, I spoke to a gentleman just yesterday who, you know, again, it's another unfathomable story, but he has a known cancer in his tonsil. He knows he has it. It's already been biopsied. It's been diagnosed. There is a robotic surgery available to him to have this cancer treated. Now, you can well imagine you're going to treat tonsillar cancer. The hope would be that you'll have a successful surgery, and perhaps you might be able to avoid the terrible radiation and dry mouth that comes after that, and disfigurement as well. His surgeon only has access to the robotic surgical assist one Thursday every 2 weeks. So as we begin to look at the failing system that exists before us at the hands of the NDP Liberal Coalition, as I said, it becomes a bit rich as to the movement of this debate. Because what have the NDP Liberals done over the last 9 years with respect to health care? Besides destroy it? Nothing. And we have heard this Prime Minister also stand up in the House of Commons and say, I remember it happened when I first came here almost 3 years ago, a little better than 3 years ago, I guess now, that he was going to provide to Canadians 7,500 doctors, nurses, and nurse practitioners to this system to make it better. And again, when you look objectively at the metrics, you have to understand that the system has gotten worse and worse and worse and worse. And the numbers of physicians continues to decline over time. And of course, those out there watching will say, well, what are you going to do about it? What would a Conservative government? Well, we've already announced a program for international medical graduates that we know there are 20,000, at least 20,000 physicians who are here in this country who have practiced medicine and trained in medicine abroad, and who have come to this country who have not been able to practice their trade. It is an incredibly sad indictment on the system run by the NDP Liberal Coalition. And this is a terrible joke. I'll preface my remarks with that. But you know what? Everybody has heard this, that in Toronto, don't call an ambulance, call a taxi, because your taxi driver is going to be a physician who is trained elsewhere. It's a terrible, terrible joke. But sadly, we know that there are, as I said, 20,000 physicians who have trained outside of this country with experience who are living here who cannot access the system. And as I go around the country and talk to Canadians and say, Conservatives have a plan, and to a person, Canadians say, that is a very common sense idea. Why would you not do that? If someone is trained elsewhere and they have experience, and as everyone says to me, you know, I'm sure the body is the same in country X as it is in Canada. I'm sure it's exactly the same. I'm sure it functions the same way. I'm sure that, you know, the liver is still on the right side of the body, et cetera, et cetera. Yes, it is. And, you know, the broken bones can be treated, and lacerations, et cetera. High blood pressure exists in every part of this world. We know that diabetes exists in every part of this world. We know that. And therefore, those folks who have received their training and experience elsewhere, everybody would say when they can have that ability to practically prove their abilities, then of course they should have a license to practice in Canada and help treat Canadians. And while doing this, what we know is there is a win for Canadians who are here now, who need access, the 6.5 million Canadians who need access to primary care. And we also know that that is a win for that physician who is here doing some other type of work and not able to practice as a physician. You know, I met a group of internationally trained physicians, and one gentleman in particular told me this terrible story that he has not been able to practice as a physician. He was working as a security guard. And again, these are heartbreaking stories because his son said to this gentleman practicing, working as a security guard, who was a trained physician, Dad, if you're a doctor, why do you go to work dressed as a security guard every day? And how do you explain that to your young child that, well, I came to this country for an opportunity, and because of the barriers that exist in this country, I'm not actually able to work as a physician here. And we know that when you look historically at Canada, of how we built this country, many people came from elsewhere with training in medicine and nursing, pharmacy, dentistry, veterinarian skills, bricklaying, pipe fitting, electricians, carpenters, etc. And how did we welcome those folks back when the country was being built up? And we welcomed them by saying, hey, let's see what you can do. Show us what you can do. Oh, here, watch me build this. Watch me do this. Watch me apply my trade. And everybody agreed, wow, you know what you're doing. And not surprisingly, the body is not different in country X compared to here in Canada. So when we look at those practical, that's one example of a practical solution that that Canadians are able to receive from a common sense conservative government, to be able to say, when you can prove your skills, then we will have you going to work and providing services on behalf of Canadians. Chair, the other metrics that we need to look at are the failing healthcare system that has happened at the hands of the NDP Liberal Coalition is related to the service to veterans. And we know, on this side of the House, we know that mental health is health. My great friend Todd Doherty, a champion of the 988 suicide prevention hotline number, who pushed and pushed and pushed, such that, in my mind, it never would have happened without Todd Doherty. And when we understand that, and we understand that veterans are calling for help to Veterans Affairs and saying, I need to access mental health supports, I've struggled, I've served my country, I've signed on the dotted line. And the answer, of course, in these terrible, again, you can't even, I wish someone would accuse me of hyperbole and making up these stories, but everybody knows they're true. Everybody knows that there are veterans in this country who are reaching out for mental health help, who were offered medical assistance in dying. That was the offer. Well, you're never going to access, I don't know what they said. You can't access it. It's too long to access it. Your case is too difficult. Whatever. Have you considered MAID? And this is not only a sad testimony as it relates to the failing healthcare system under this NDP Liberal coalition, but it also relates to how do we treat our veterans. I'm a proud veteran. I'm grateful that you're very welcome, Todd. I'm grateful for having the opportunity to serve. It taught me a lot of things, and here we are offering veterans not help. We're not saying here's a hand, grab hold, I don't want you to die. What we are, not us, what the NDP Liberal Coalition government is offering is medical assistance in dying to veterans who need incredible amounts of mental health support because of what we as a country have asked them to do. We have said, will you sign on the dotted line? Will you serve? Are you willing to give the ultimate sacrifice for doing what we believe as a country is right? And they answered that call. They said yes. And this NDP Liberal Coalition government failed them. Failed them. And Chair, if it were only one veteran that was failed, maybe someone could call it a mistake, but it was not. It was not only one veteran. It was multiple. This was a pattern of behavior that, to me, can only come from where all the decisions come from in the NDP Liberal Coalition, and that is straight from the Prime Minister's office. That is where it would appear that all of the decisions come from. And that is a sad, sad state of affairs. We've been debating opioid therapy here, and I found it very rich today that, again, 9 years have passed, and the only argument that the NDP Liberal Coalition has come up with is so-called safe supply. Let's give out free drugs. And I find it absolutely fascinating that suddenly colleagues on the opposite side are now saying, well, we need comprehensive treatment. Well, we've been talking on the conservative side of a common sense solution of comprehensive treatment for years now, ever since I came to this place 3 years ago. Those are the things that we have been talking about on this side of the House. We do not believe that giving out endless supply of high-powered opioids are what is going to enable this crisis to end. But what we do believe, we believe that there is a possibility for rehabilitation and treatment for every person that is affected by the opioid crisis. We do not believe in just giving them opioids, which is palliative care. That is saying to them, hey, guess what? You are never going to get better. Just take these drugs, and basically I believe the Costly Coalition wants them to take drugs and be quiet, because then they're not a problem to them. And that, of course, is an absolutely ridiculous thing to do. So as we begin to understand, what the NDP Liberal Coalition has done to destroy health care in this country, it is an incredibly rich and perhaps unparliamentary for me to say, ridiculous argument to say that they want to talk about the health care system suddenly as it becomes a ballot box issue. And, we begin to see what's important to Canadians. Well, first of all, as the people that I visit and the doors that I knocked on, the cost of living, cost of living, cost of living, and cost of living. Those are the important things. I cannot put gas in my car. I cannot put food on my table. I cannot put a roof over my head. And so those things are what we hear every single day. And if all of you who sit around this table are not hearing that, I suggest you should have your hearing checked. And then suddenly healthcare becomes a ballot box issue. Okay, well, hey, we should address healthcare. Why don't you get rid of the carbon tax and address the cost of living? Because we know that one of the determinants of health is the ability to go ahead and put good food on the table so that you can have a healthy life. Those are things that are incredibly important. And those are the changes, the Blue Seal program, the getting rid of the carbon tax, the fixing the budget, building houses, stopping crime. Those are things that those of us on this side of the House are seized with. We're not seized with fanciful notions of suddenly having a wake-up call of now we're going to treat people with opioid addiction properly after not doing it for 9 years. Suddenly we're going to fix the most revered public health care system. That's not what we're seized with on this side of the House. And Chair, as you well know, there are many, many more things that I could go on about, but seeing the clock at 1:05, I would suggest that we should adjourn this meeting at this time and pick it up later. I move to adjourn.
So we have a motion to adjourn. Is it the will of the committee to adjourn the meeting? All those in favor of adjourning the meeting, please raise your hand. All those opposed? Okay, so the meeting is not adjourned. Dr. Pawlowski is next on the list.
Let me start by asking what's the order after me?
Mr. Doherty, then Mr. Theriault.
So clearly the Conservatives are filibustering. They don't want to have a vote on this motion. They don't want to study the increasing privatization of healthcare. And why is that? Because I think they know very well that the Canadian public does not agree with this. You see one survey after another asking Canadians, what is it to be a Canadian? What's the most important thing to distinguish us as Canadians? Invariably, it comes down to two things: hockey and our public health care system. And I think the vast majority of people don't believe in privatization of healthcare, and I think the Conservatives filibustering clearly indicates the fact that they don't want to talk about this because they don't want to publicly show their support for privatization of healthcare because they know this is not a winning issue amongst the Canadian public. That's why they're filibustering. So with that said, I see there's a bunch of Conservative speakers afterwards. Motion to adjourn the meeting.
All right, we have another motion to adjourn. Is it the will of the committee to adjourn the meeting? Okay, I see a majority with their hands up, and therefore the meeting is adjourned.